Good afternoon, everyone. We're going to talk a little bit about the nursing care plan and data mining. So we're just going to kind of jump right into it. So the data mining article that we reviewed looked at the nursing care plan framework and has three key data points that it uses in its framework. So data extraction from the database or the warehouse, data cleansing and pre-processing, including feature extraction and dimensionality reduction, which is a fancy way of saying, let's make sure we have the correct data that we're looking for, and it doesn't have extraneous information that can alter or skew our results. And then an iterative analysis and prediction model development and verification using data mining tools. So validating the data and the results that we have found um, moving forward. So nursing data really is the basis for all of our medical data mining according to the article. So it's our basic, most data set that we use. Medical diagnoses are reported to be much harder to extract because they don't have a standardization like nursing does. So a lot of the diagnoses up until recently were actually free text that the doctors would be able to just type in what their diagnosis was, which made it a lot harder to really extrapolate the data because of that. And it's believed that health information as a whole really is measured in zettabytes. So let's think about that for a second. A zettabyte is 1 and 12 zeros worth of gigabytes. So our average computer at home that we're working on right now is between 500 gigabytes and a terabyte or 1,000 gigabytes. This is 12 times that. So this is a huge, huge difference in a mountain of data that we have to work through to get the data we need to data mine. So nursing data, we said, is standardized data. So we're all very familiar with our NANDAs and our nursing outcomes and our nursing interventions to support the outcomes, to support the NANDA, to improve patient care. And the HANS formula or the HANS data extraction model or mining model is something that is easily used, and we're going to take a look at that in just a couple of minutes here. So, if we go into it, here is what our nursing care plans are, according to the HANS model that is part of um, the search research paper that we reviewed. So clinical documentation up here in the front, this is where we as bedside nurses are caring for our patients and putting our nursing care plans together that are individualized and stored in the EHR, and the healthcare administrators are able to review that data and make sure that the appropriate interventions and care is being delivered to the patients. And our EHR system, this is our database or our data warehouse. So this is where the standardization is developed and implemented, our terminologies, all of our outcomes are collected in our patient information. From that, we can turn it over to data miners and visualization experts and statisticians who are able to look at this data, analyze it, and find trends and see different knowledge discovery that can help improve patient care and reduce costs. And they share this with the stakeholders, and ultimately it gets implemented into our EHR, where we are able to implement it at the patient bedside and improve our patient outcomes. So data in this study, and average, there are 747 attributes in the databases. So these are all the different data points that a patient can experience. But as nursing as a whole, we utilize less than about 2% of that data at a given time per patient. So to disperse the data, the dispersed data, I'm sorry, helps to improve patient analytics because it is much more focused rather than trying to say how the patient meets 747 attributes. It might be one or two. Excuse me. So, some of the new goals, obviously, we want to improve patients, we want to improve the patient impact, and look at the bigger picture. So, how could we do that today? Well, we look at data and use that to advance. So, if we're care plan mining, again, for another graphic representation of care plan mining. So there's the EHR databases at the top, and there are SQL queries that are created looking for specific data. They use keyword searches to grab this data. They transform it and they clean it to make sure it's appropriate data and it's appropriate to what the research question is looking at. And then they're able to test it in a data mine and implement it into the training environment and help start to improve the care plans and the interventions and reducing patient errors and poor patient outcomes, ultimately improving the bottom line. So if we look at impaired gas exchange, mechanical ventilation, so impaired gas exchange would be our NANDA with our um, outcomes of improving medical ventilation response. And how are we going to do that? What are our interventions? So sedation management, air aspiration precautions, infection control. We could be looking at respiratory status, which would be gas exchange, and interventions of our oxygen therapy, our chest physiotherapy, making sure our acid base management is appropriate. So all these are different attributes, so that impaired gas exchange, the impaired physical mobility, and then having our outcomes. So this is how, even though there are 747 different attributes that could be on a patient, we're using less than 2%. So here we have 3 of the 747 with associated outcomes and interventions to improve patient care and the patient experience. So big data, again, we've talked about this. So here is the studies data. They had 787 nurses in 4 different institutions with 42,000 nursing-related issues. So the different NANDAs based on patient admitting diagnoses, with 357,000 different care plans. So that is a lot of data that we're able to use to improve and see how this really can affect us from an informatics and a leadership standpoint. With 34,000 unique patients. So all those different patients, not every patient's going to be the same, and every patient's going to have a different care plan, which allows us to have really good information. So in the study, they also had an end-of-life data example. And for end-of-life care, there's 144 approved NANDAs that relate to end-of-life. So the approved NANDA is chosen by the nurse to guide the patient's outcomes, the nursing diagnosis driving the nursing interventions. In our outcomes, we have nursing outcomes that are supportive of the nursing diagnosis. So like we looked at with respiratory, having the infection prevention, the aspiration precaution. These are the goals that we're trying to make sure our patient meets, allowing us to have a more holistic view of our patients and their families. And our nursing interventions, these are the data points that really we're trying to reduce costs. So if we're able to implement infection control or infection prevention appropriately or aspiration precautions appropriately, it's going to lead to reduced complications for the patient and thus reducing our overall costs for care delivery and improving our revenues bottom line. So picture the possibilities, improving our patient outcomes and satisfaction, and not only our patient satisfaction, but our family satisfaction. So if we are able to reduce falls with appropriate care plans and keeping our patients from falling, it's going to not only reduce our costs due to additional care that we would have to give our patients with imaging, but also patients' families thinking they know, we know as nurses what we're able to do. So moving forward, some of the data mining techniques that are validated and out there are association mining, clustering, and classification and regression. These are able to really produce results that can be analyzed really for 3 classes: the patients, giving them a better understanding of how the hospital performs; healthcare providers, so us, doctors, PT, OT, all those different classes of providers that deliver the care; and then the organization, right, looking at our bottom line. And lastly, our improvement compliance with our interventions can reduce cost due to the ancillary events while improving patient care and desired outcomes. Thanks, guys. Have a good day.